Okay friends, let's continue our dermatology revision. So first is this is anogenital wart, and this is caused most commonly by HPV 6 and 11. This is human papilloma virus. 6 and 11 is most common cause, also known as Buschke-Lowenstein tumor, generally called as Candyloma acuminata. Okay, the treatment is the podophyllene, and newer drug can be applied imiquimod that works on toll-like receptor 7 and 8. Next, Nevus anemicus versus vitiligo. Nevus anemicus is localized area of vasoconstriction. So vasoconstriction is important point here. And vitiligo, here is the loss of melanin. So dioscopy in the nevus anemicus, blanching is seen, and if we massage the area, massage fails to develop erythema. In vitiligo, on dioscopy it remains paler. Next one, this on extensor surface, this is the Rhinoderma. This is a follicular hyperkeratosis, and this is caused by deficiency of vitamin A, B, C and E, and essential fatty acids. Also can be due to malnutrition. Treatment is vitamin supplement. Okay, next one is the hand foot mouth disease. This is caused by Coxsackie virus A16, and this is spread by droplet and fecal contamination, and the treatment is symptomatic only. Incubation period of this hand foot mouth disease is around 7 days. Okay, next one, this photo is of psoriasis, and exacerbation is by beta blocker, ACE inhibitor, lithium, anti-malaria drugs, aniside, TNF alpha inhibitor, and some infection also, just like a viral bacterial infection. One of the bacterial infection condition is known as cutate psoriasis, is by streptococcal infection. Next one is the osteomany. What is this? This is seen in LGV, lymphogranuloma venereum. This osteomany is seen in the tertiary stage of LGV. This is genitoanorectal syndrome. Here is osteomany, here vulva edema is seen. Okay, let's continue. Osteomany, this is caused by LGV. Primary ulcer is that occurs 3 to 30 days after exposures, and the secondary stage develops 2 to 6 weeks later, and this mainly involves inguinal and femoral lymph nodes that is painful and tender. And third stage, a special character of vulva is seen, known as osteomany. Okay. It can also be seen in male in coronal sulcus of penis. In female, it is seen in posterior vaginal wall. So donovanosis, next one is the donovanosis. Here is no. So no means their lymph node involvement is not there. Okay, this is caused by Klebsiella granulomatis, also known as Calymatobacterium, granulomatous. It causes granulomatous lesions in subcutaneous nodule, subcutaneous tissue, sorry, that is known as pseudobubo. Next one, this is the anterior shin lesion, this seen in diabetes, and this is what, this is necrobiosis lipoidica, necrobiosis lipoidica. This condition is necrobiosis lipoidica. Okay, some other chin lesion, anterior chin lesion, can be seen in hyperparathyroidism, that is called as pretibial myxedema. Sarcoidosis can also cause anterior chin lesion that can ulcerate. Okay, this condition is plaque psoriasis, and in the plaque psoriasis, interleukin 23 inhibitor can be used. The name is guselkumab. It is given subcutaneously, and this is used in moderate to severe plaque psoriasis. Okay, and most common side effect of guselkumab is upper respiratory tract infection. Okay, we have some other drugs, that is IL-17 inhibitor, and this is brodalumab, IL-17 inhibitor. Another one is ixekizumab. TNF alpha inhibitor, we have etanercept. Next one, this is nevus of Otta. It is the extensive bluish patchy dermal melanocytosis of sclera and skin, more commonly seen in female. Okay, it is distributed along with first and second branches of trigeminal nerve. Next one, we see here dorsal interpharyngeal or metacarpopharyngeal, can be seen on elbow or knee joint. This is the Guthron papules. It is seen in dermatomyositis. This is the autoimmune condition, disease, and it involves skin and skeletal muscle both. In the same dermatomyositis, around neck, shawl sign or V sign can be seen, and this is fixed macular erythema, around shoulder arms also. Okay, so let's see some of the antibodies seen in dermatomyositis. We have anti-Mi2 antibodies, anti-Jo1 antibodies, anti-P155 or P140 antibodies. Next one is the most common type of psoriatic arthritis is asymmetrical oligoarthritis. Next one, this picture is showing pitted keratolysis. So pitting is here seen due to the serine protease enzyme that is eating these keratocytes and causing pitting, and this occurs where pressure bearing area. This is associated with Corynebacterium and also with Chytococcus, and hyperhidrosis is seen in this condition, hyperhidrosis. Next one, we will see some lesion type and corresponding disease. Annular skin lesion is seen in tinea corporis and granuloma annulare. target lesion like is seen it in erythema multiforme and erythema migrans. Okay, reticulate lacy vicamistria. This is seen in lichen planus. Apple jelly nodule like lesion is seen in lupus vulgaris and sarcoidosis. Lupus vulgaris and sarcoidosis. Next one. So this is chromoblastomycosis. It is seen in the farmer of sub-Himalaya belt region. So it is the varicose growth, and here the sclerotic body or medullary bodies is seen. Sclerotic bodies or medullary body is seen. Next one is the buttonhole sign, where it can be seen NF1 neurofibromatosis 1 and dermatofibroma, but it is not seen in bullous pemphigoid. Okay, here is the child perioral. This is skin eruption is seen and around genital area. Okay, this is usually post weaning from breast. If we say about in children, this is the zinc deficiency acrodermatitis enteropathica. Condition is associated with diarrhea, alopecia, perioral acral cutaneous eruption. In adult, this can be seen in alcoholisms and vegetarian. Next one is the strawberry vagina. Strawberry vagina with greenish discharge, greenish and itchy discharge. This is the condition. Trichomoniasis, and drug of choice is metronidazole. How it can be given? How it is given? 2 gram single oral dose. And here all partners must be treated. Next one is the cement exposure will cause chromate allergen. Chronically, cement exposure can cause chromate poisoning. This is the chromate is the allergen here. Okay. So this is one of the occupational contact dermatitis. Next condition is the leprosy, and here biopsy of nerve most commonly is done of superficial sensory branch of radial nerve. Superficial sensory branch of radial nerve. This is the gold standard technique of biopsy for diagnosis of leprosy. Next condition is next one is the zinc smear. Zinc smear, it showing the giant cells in herpes zoster, and zinc smear. So zinc smear making we have to use Giemsa stain, right stains, toluidine blue. Okay, next condition, this is the purple colored plaque. This is the Kaposi sarcoma seen in immunocompromised patient, and the most common location of this Kaposi sarcoma is feet, but sometimes can involve hand, ears, nose. It has low grade malignant potential. Okay, next one, this is what we are seeing, lupus band test. This is seen in subacute cutaneous lupus erythematosus. There are many conditions, but one of them is subacute cutaneous lupus erythematosus. And what is here? So this greenish belt is the band of immunoglobulin at dermoepidermal junctions, and the antibodies are involved that are Rho or SSE antigen. Usually condition is good good prognosis. Okay, next one. Again, plaque psoriasis, the lesions coalesces to form bigger one known as some, this is the geographical lesions, and something is increased here, something is decreased here. Okay, so let's see what are the condition that increases. T helper 1 and 17 will be increased in this condition. Inflammatory cells will be increased. Cytokines will be increased. But few conditions that decreases in plaque psoriasis is T helper 2 cells. This will decrease. Interleukin 4 and 10 will be almost absent. In anti-inflammatory cells and cytokines will be decreased. Okay, next condition. Next is the Saha syndrome. It is seen in PCO, obesity and infertility. So let's elaborate this Saha. S is the seborrhea, A is acne, H is hirsutism, and another A is androgenic alopecia. So thank you very much.